here we go. So just to kind of finish up. So the last thing I wanted to talk about is this cycle right here. So this is the last cycle, and this is something called beta oxidation. Beta oxidation, at least in animals and humans, beta oxidation is one of the ways that we can break down fatty acids. So what happens is fatty acids come into the beta oxidation cycle, and there are several things that come out of it. So do you guys see the NAD and FAD coming in? And then you see NADH and FADH2 coming out, right? So guess what? NADH and FADH2 can come out and be sent to electron transport. So that's one of the things that can come out of beta oxidation. Fatty acids go in, NADH and FADH come out to help power the electron transport cycle. All right. Another thing that comes out of beta oxidation is acetyl coenzyme A. And where can acetyl coenzyme A go? Well, it can go into glycolysis. Remember, pyruvate gets converted to acetyl-CoA in the Krebs cycle, right? And then it can go through the Krebs cycle. So acetyl coenzyme A can be fed directly into the Krebs cycle as it comes out of beta oxidation. So here's a question that I want to ask you. And the question is, do we need glucose to make ATP, or to make lots of ATP? What do you think?
To make lots of ATP?
Yeah, to make large amounts of ATP, do we necessarily need glucose?
I think you yield more with glucose. But
You do.
You do. Use fatty acids as well.
Yes. So do you guys see this? So here I have glucose. Right, this is the primary story that we tell, right? Glucose comes into glycolysis, it gets turned to pyruvate. Pyruvate goes in the Krebs cycle, it gets converted to acetyl-CoA, CO2 comes out, electrons and hydrogens go to electron transport, lots of ATP is made, right? That's kind of the classical story. But here's the thing, if I take glucose away, right, do I still have a mechanism for creating ATP? Yeah. I can start, instead of at glucose, I can start at fatty acids, right? And I can feed fatty acids into the beta oxidation cycle, right? I can oxidize the beta carbon on these fatty acids. That's where the term beta oxidation comes from. So fatty acids can come in, and the fatty acids can get converted to acetyl-CoA, right? Acetyl coenzyme A, and NADH and FADH2. And the acetyl-CoA can go in directly into the Krebs cycle, right? And the NADH and FADH2 can be fed into electron transport, right? And you can get a lot of ATP produced that way. Do you guys see that there? See that as a mechanism. Many cells within your body are able to do this effectively, right? If you do not have glucose, your cells can become fatty acid burners, right? Quote unquote, burn fatty acid. And do you see how that can happen through beta oxidation? Does that make sense? Now, there are some cells that are not able to do this very effectively, and those cells include things like neurons, right? Neurons in your brain are not particularly good at using beta oxidation. So if your blood sugar were to get too low, your neurons are still going to suffer, right? Does that kind of make sense? Right? Interestingly enough, neurons also do not need insulin. Right? Insulin is not needed to facilitate the movement of glucose into your neurons. So knowing this, understanding this, actually sets us up for a deeper understanding of diabetic ketoacidosis, right? Right. So what happens in diabetic ketoacidosis?
Your insulin you're not produced, or glucose can't get into the cell, so your glucose builds up.
Okay, so the first thing is you're not making insulin, right?
Yeah.
You're not making insulin, right? Type 1 diabetics. DKA tends to be a type 1 diabetic problem. So you're not able to produce insulin, which means that glucose cannot get into your cells. Well, is that totally honest? Not totally honest, because what cells can glucose get into? Can get into your brain, right? Does that make sense? So in DKA, right, glucose levels get really high because most of the glucose can't go into most of your cells, right? Except your brain, your neurons, right? So your neurons continue to function. They don't need insulin. So, okay, fair enough. The rest of your cells, though, there's a problem, right? The rest of your cells are like, hey, we're not getting glucose. We need to make ATP. What happens then?
It goes into fatty acids.
Good. So those cells recognize, okay, I can't make energy through this pathway here, so what I'm going to do is I'm going to start using beta oxidation. I'm going to start breaking down fatty acids, right? And so those fatty acids go into beta oxidation. Acetyl-CoA is fed directly into the Krebs cycle, right? And then NADH and FADH2 gets fed over to electron transport, and the cells can make energy just fine. Okay, what's the problem?
It's the byproduct, right?
Okay, yeah. So maybe there's some byproducts made, but is there a big problem there? Doesn't seem like a big problem to me. Well, yeah. The problem is that glucose keeps going because you're not using it, right? And so what happens to the glucose? It keeps getting higher and higher and higher, and really the only cells that are able to use glucose are your neurons, right? The rest of your cells aren't, your muscles and all that. They're using primarily fatty acids. And so your glucose is getting higher, and what's that doing? Well, that's making your blood very hyperosmolar, right? And it's pulling fluid out of your cells. It's dehydrating your cells, right? And then as that fluid gets pulled into your vascular compartment, right, well, what happens? Your kidneys are like, hey, I need to get rid of this glucose, right? And so you start urinating a lot. So what's happening? You get dehydrated, profoundly dehydrated. You develop hypovolemic shock, like we talked about earlier, right? Okay, so you got hypovolemic shock, really high glucose levels, and on top of that, when I have excessive amounts of acetyl coenzyme A being produced, some of that acetyl-CoA can get fed into the Krebs cycle, and some of it gets converted into some other molecules. And there are 3 molecules in particular that I want you to associate with this acetyl coenzyme A, and that those include ketones, primarily acetone, right? Acetone is a primary ketone that gets produced, and something called acetoacetate, or acetoacetic acid, and something called beta hydroxybutyrate. Now, the acetoacetate and the beta hydroxybutyrate are acids. They're carboxylic acids. The ketones, the acetone, is not an acid. It's a ketone, right? It does not have a COOH group attached to it, right? So the ketones are not really a huge problem. And I know we call it diabetic ketoacidosis, but ketones are really the least of our concerns. Does that make sense? The ketones aren't a big deal. It's really this buildup of acetoacetate and beta hydroxybutyrate. These are very acidotic, and that's what leads to the acidosis, right? So with DKA, there are multiple things going on. You've got too much glucose, which is making your blood hyperosmolar, and that causes fluid to shift out of your cells. So your cells become dehydrated, right? The other thing that happens in response to this high glucose is your kidneys attempt to get rid of the glucose. Well, how do they get rid of glucose? Well, they have to get rid of water, right? They have to pull water out, and so you lose lots of water, right? And you lose volume. So you become so you're hypovolemic, you have hyperosmolar blood and dehydrated cells, intracellular dehydration. And then on the other front, you've got lots of acetoacetate and beta-hydroxybutyrate that's getting dumped into your circulation, so the pH of your blood is decreasing, and you develop a profound metabolic acidosis, right? Does that kind of make sense there? Okay. And so that is primarily what we see with diabetic ketoacidosis. Now, there are also some diets that make use of this mechanism. Probably the most common diet that you may hear of is something called a ketogenic diet. Have you heard of that before? A ketogenic diet is where you limit the amount of carbohydrates you are eating. And remember, those carbohydrates ultimately get converted to glucose, right? Those complex, those what we call polysaccharides get chopped up, by amylase and other enzymes, and they get converted into these simple sugars, these monosaccharides like glucose that can be fed in. So what we do is we limit the amount of carbohydrates we have in our diet. And what that does is that forces the cells in our body, obviously neurons are the exception, but that forces many of the cells to rely more heavily on this beta oxidation pathway. In principle, what that should do is that should cause us to what? That should cause us to burn fatty acids, right? And so people will sometimes use the ketogenic diet as a way to lose weight, as a way to burn fat and to decrease body weight.
I think beta-hydroxybutyrate is it like a salt? Some type of I think it's a salt.
Well, I mean, it is, and that's an acid, right? I mean, it dissociates into an ion. Beta-hydroxybutyric acid is its proper name, and then it dissociates into a hydrogen ion, and then it's anion. So I guess in that sense, it has that ionic character like a salt, right? Beyond that, I can't really speak about or to the ketogenic diet. I'm not necessarily saying it's a good or bad thing. I'm just saying that it's something that you're going to run into, and there is a mechanism that people are making use of, and so these people may have very high ketone levels in their body, and they're not necessarily ketoacidosis as we would know it. Other people where this can happen is if you have someone who's very malnourished, they may also go into a ketogenic state or ketotic state. Probably the more common situation where you'd find this is in a chronic alcoholic patient who is drinking a lot of alcohol and not eating much, and you've run into these people, right? They're drinking a lot of alcohol, they don't have a great diet, and sure enough, they are in a ketogenic state, and they got lots of ketones, and sometimes they can even develop full-on ketoacidosis as a result of that alcohol use, and again, that's more due to, it's due to a couple of things, but a lot of it's just due to not having a great diet. It's just an alcohol-driven diet. Okay, does that stuff kind of make sense there? All right, so these are just a few of the many metabolic pathways that are all interrelated and intermixed, and then every step on every pathway involves an enzyme, and these enzymes often involve coenzymes, and some of them need ATP and some of them don't. And you can see it's just a big mess, isn't it? It's just a big mess of stuff going on.